I get the band. Run it, run it, run it, run it. Woo, woo. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run it back. I get it back and I run it up.
Hello, everyone, and welcome to the roll call. I am Obunda, and with me is
Ebinimi, good to see you all. Welcome.
together we will be your host for this virtual show today. Before we begin, we have a few housekeeping items to take care of. Number one, mute your devices. We have a few people on the roll call here today. So please mute your devices. Background noises are a pain in virtual events of this nature. Number two, this virtual lecture will be semi-formal. It means that while this is a very important topic, we will add a little humor. Number three, we intend to make this show interactive as much as possible. So you can send in your questions in the chat. Ibinimi, my partner and co-host, will aggregate the questions in order of relevance, merge similar questions, and relate the questions to our guest speaker at the end of the presentation. Please feel free to ask any question. No question is a dumb question, especially when our health is involved. So let's get to the meat and potatoes of today's event. I am thrilled to be your host today for this important discussion on heart health. As we navigate life beyond our 30s, it is crucial to prioritize our cardiovascular well being. So, whether you are tuning in from the comfort of your homes or joining us from anywhere across the globe, get ready for an engaging and informative session. To kick things off, let's delve into why our heart health matters, especially after we hit the milestone of 30 years. Most of us are probably around the 40s now, so this conversation it's very relevant for us. Our heart is the engine that keeps us going, and taking care of it is essential for a long and vibrant life. But at the same time, it's easy to overlook amidst the hustle and bustle of daily life. That is why today we have our friend and brother to share invaluable tips and insights on how to maintain optimal heart health well into our 30s and beyond. Now, without further ado, let me introduce our esteemed guest who will be sharing his expertise with us today. Please welcome Dr. Wobo Bekwelem. Wobo is a renowned medical practitioner specializing in cardiac and intravascular medicine. With a wealth of professional experience and a track record of educational achievements, Dr. Bekwelem has risen to his current role as an adjunct professor at the Department of Family and Preventive Medicine at the Esteemed University of Utah Medical School. Dr. Wobo has served in various capacities at prestigious institutions, some of which include West Medical Center, Utah, and currently he is the international cardiologist and director of vascular medicine at North Memorial Health in Minnesota, United States of America. Dr. Wobo's dedication to academia is evident through his contribution to 20 peer-reviewed academic medical papers, solidifying his reputation as a respected scholar in the academia field. Finally, our own Dr. Wobo imparts knowledge and expertise as an adjunct professor at the Department of Family Preventive Medicine, University of Utah. Today, Dr. Wobo will shed light and present to us the lifestyle factors that contribute to a healthy heart after 30. Please join me with a thunderous applause as we welcome our own doctor, PF Numbere's bestie and seatmates, Kofo's ally and dependent, our own Ikore ninja, but America took away the sword, or did it take away the machete? Join me to make welcome Dr. Wobo Bekwelem. You are welcome to the first roll call season 1, episode 1. And with that, I pass the mic over to you, sir. You have the floor.
Thank you very much, Obunda and Ebinimi. Very nice, very kind. So I'm just going to jump right in and talk about heart health. And at the end of this, if you miss something, the PDF is going to be available in the chat. The hosts are going to share the PDF with everyone so you can have it, because I put in some information there that you can always refer to and use as a reference over time. So the big question: what can I do today to prevent heart disease? Next slide. The biggest thing to remember why this matters, let's go to the next slide, is that heart disease is the world's biggest killer. So when someone dies suddenly, more often than not, the reason for that is heart disease, in one way or the other. And I'm going to go into a little bit more detail about this. And all over the world, most of people that die suddenly or pass away young or even old, mostly it's because of heart disease, and it's important to try and prevent it before it gets to that point. And there are a lot of things we can do in our 20s and 30s and 40s to prevent it going forward. Next slide. One of the things to think about is, what are the risk factors? Now, most of the risk factors can be prevented or can be worked on, but there's a couple of them that there's nothing we can do about. For example, when you see on this slide, there is a genetic predisposition to heart disease that really there's nothing you can do about in general. If you have, the genetics for it, in other words, like a strong family history, you can't change your family history. You can't change your genetics for that. But there are things that you can change. For example, smoking is a big one. It's a huge contributor. Eating unhealthy food, consuming too much alcohol, some infections can cause it. Obesity. So if your weight is not, controlled and you're not paying attention to it, that's a big contributor. Being sedentary, not just being active. Most of us, we're busy with life. A lot of times you're sitting, in the office morning till night, and then you come home and you sit again in front of the TV. So there's really no physical activity or exercise in your daily regimen. That's a big problem. That can affect, heart disease. The other two things are age. Whether we like it or not, we're going to get older. So there's nothing you can do about age. Stress, there's some things you can do about stress. We can talk about meditation or trying to find ways to control your emotions and things like that. But overall, stress impacts all of us. Next slide. And some of the things we look at, of all these risk factors, there are certain ways we can calculate your risk. So when we talk about risk of heart disease, it's a combination of a lot of things. And like I said, there are things you can change and there are things you cannot. Again, things you cannot change are your age, your family history, a previous history, whether you're male or female. But there are certain things that you can absolutely change. And each of these things individually contribute to the complete risk or total risk for heart disease. So there's your blood pressure, the blood sugar or diabetes, your BMI, a calculation, a composite of your weight and your height, chronic inflammatory conditions like infections, your diet, your exercise, your cholesterol, blood levels, smoking, stress, total cholesterol. So these are things, next slide, that you can control. And we're going to go into a little bit more detail of all of them. Now, one question that I get asked a lot is, how do I know which of these risk factors I have? You could say, okay, the controllable risk factors, age, family history, previous history, I don't really have that. But then how do I know if I have high blood pressure? How do I know if I have elevated blood sugar or chronic inflammation? It's important to ask these questions because most of these things don't have any effects on you initially. So for example, people, sometimes think that when your blood pressure is really high, you get like significant headaches or you feel tired or, but a lot of times people would have had high blood pressure for a long time, for several years, where it has had tremendous impacts on your body negatively before you can even feel any symptoms from it. So that's why, to answer the question, how do I know? You got to get screened. You cannot say, oh, I feel healthy, or I feel fine, or I don't have high blood pressure. I can't tell you how many times I'm talking to a patient and say, oh, I don't have high blood pressure, I don't have high cholesterol, I don't have diabetes. And then I ask, how do you know? And they're like, yeah, I've never been told. Well, that's because you've never been screened. So it's very important. Screening, if there's one thing you take away from this talk, is to know that the one way that you can figure out these risk factors and start to control them is you have to get screened. Because again, I'll say it one more time for emphasis, a lot of them don't have any effects on you initially, and by the time they start having effects, it's too late. So one of the screening points is, starting at age 20, you got to, check your body weight, you got to check your blood pressure, and you can do that by going to a doctor or by having like a simple home blood pressure test. You have to do some blood tests for your cholesterol. That can be done with a doctor. There's something called an electrocardiogram, which is a monitor of your heart. And I'm going to talk about that in a little bit more detail. You have to check that to see if there's any, it can give you some signs of any heart damage or effects on your heart. And if you're older than 20, which I assume all of us are, and you haven't done this yet, you have to do it as soon as possible, because then you can get ahead of it and then figure it out. And again, the frequency of how often you do this depends on what your initial results are, what your risk factors are, and then what goes on from there. Next slide, please. We'll start with the first one, and that's blood pressure. Now, blood pressure is very important because, again, of all the risk factors, this is the one I call the silent killer, because a lot of times people have had high blood pressure for several years and don't even know it because they just never checked. So usually, like I said, high blood pressure does not have any symptoms, initially. Before it starts having symptoms, you'd have had it for an extended period of time. So the best way to figure it out is to check it initially. And when I have a chart here on the slide talking about, the blood pressure, what's normal, what's elevated, what's high, and what's severely elevated. So generally, as young people, our blood pressure really should be just right around 120 or less. For the upper number, which is the systolic blood pressure, and less than 80 for the diastolic, the lower pressure. So if you have a pressure of 119 over 70 or 120 over 70, that's fine. It certainly should not be higher than that. And now you have to note that blood pressure changes all the time throughout the day. So if you check the blood pressure in the morning, it might be different from the afternoon. So oftentimes I like to say, it's easy to just get a small blood pressure machine that you can get from anywhere and just have it at home and just check your blood pressure from time to time. The fact that you checked it last week and it was fine doesn't mean it's not high again next week. And if it's one number that's high, that's not really a big deal, because, if you're stressed out or there's a lot going on, it might be high 1 second. But then overall, what we are concerned about is the average of the blood pressures being this number. Next slide, please. And the next thing is the body weight. With the body weight, generally speaking, I intentionally put this chart in the slide because it gives you like what the body mass index is, which is the BMI, and your weight, depends on your height. So, for example, you can't just kind of look at the weight in isolation. You have to look at how tall you are. For example, if you're 6 feet tall and you're 70 kilograms, then you're fine. But if you're 70 kilograms and you're 5 feet tall, then you're certainly overweight or obese. So, based on the chart, it's just a simple chart. You can just look at your height and then look at what your weight is. And if you're right around in the kind of the healthy margin, which is that orange area, then that is where, you should be. I mean, the healthy, and kind of the green and the yellow area, those are kind of like the healthy body mass indices. Now, most of us are kind of right teetering on between the yellow and the orange. And, we can talk more. Basically, if you're really in the orange, firmly in the orange, then you want to start working on losing weight, usually diet, exercise, which I'm going to go to next. And let's look at the next slide now. And when we look at the BMI, you can see this chart here kind of looks at another way of looking at the BMI. There's just multiple health risks that happen as your BMI goes up. Now, some of us have, low weight, and low weight itself is not good either. But then overall, high weight is way worse. So as you can see, as the line goes up, as your BMI goes up, your risk of heart disease, your risk, not just heart disease, but other health problems go way up. And these are things that are related to your weight. We talked about diabetes, high blood pressure, high cholesterol, heart disease, stroke, gallbladder disease, your joints, arthritis, sleep apnea, liver disease, cancer. All these things worsen as your weight goes up. Next slide, please. And then along with, the weight and the blood pressure, the diabetes is a big one. Now, diabetes is one that a lot of times, once you have, a history of high blood pressure, or your weight is, higher than normal, the next thing that naturally follows is diabetes. And it's important to really know this, because a lot of times, I was talking to my mom the other day, and she was talking about, she checked her blood sugar, just a simple blood sugar, and it was high. And then, she checked again and it was low. And I was like, well, first of all, your blood sugar, just checking like just regular blood sugar, if you've never been diagnosed with diabetes, is not really enough to make the diagnosis of diabetes, because your blood sugar can go up and down depending on, your stress level, depending on when you last ate, depending on the time of the day, and things like that. So the best test to really determine diabetes is a test called the hemoglobin A1C. Hemoglobin A1C is a blood test that kind of really looks at your average blood sugars over the last 3 months. And just like you might notice a theme here, and that the average numbers are more important than a single number. So just checking a single number of your blood pressure or a single number of your blood sugar is not enough to make a diagnosis one way or the other. But an average, in this case, will be the hemoglobin A1C. So for example, a hemoglobin A1C that's good is about 6% or less. And if you have a hemoglobin A1C of 6% or less, you don't have diabetes. However, if it starts going up to 6 and 7 and 6.5, then we start getting to the range of what we call pre-diabetes. And that's important that we pay attention to that, because then we might have to start working on, again, brings us back to lifestyle changes first, exercise, diet. And I'm going to talk a little bit more about diet in a minute. But lifestyle changes, and then eventually medicines to start getting aggressive to get it under control. To, again, make sure we don't develop heart disease. Next slide, please. Now, overall, when we talk about, heart disease, when someone has diabetes, there is a 2 to 4 time increase in the risk of heart disease. Diabetes is a big contributor to heart disease. So once a person has diabetes, then we almost automatically assume that there's already heart disease starting. So if you're ever diagnosed with diabetes, or if you ever find a hemoglobin A1C that's high, it's very important to get aggressive with it. They might say, your doctor might say, okay, do some lifestyle changes first before we start medicine, but never be reluctant to get on medicine for this, because it's important to get it under control, because it's almost automatic that once you have diabetes, you would have heart disease. Next slide, please. And now coming to physical activity and diet. Now, this is, of all the things that, I talk about, this is very important, because this is something that everyone can do. Some people are going to end up on medicines to treat high blood pressure. Some people are going to end up on medicines to treat cholesterol. Some people are going to end up on medicines for diabetes. But everybody, irrespective of your health condition right now, has to work on their physical activity and their diet. And this is just a simple chart to kind of look at, okay, what are the things, what are physical activity? And one way I like to keep it really simple, and that is, overall, you must have some sort of physical activity over a 7-day period of 150 minutes. The way I do it simply is I try to do 20 minutes every day of some sort of physical activity. Usually it's like walking. It might be like parking a little bit farther to walk into a restaurant, or to work into to work, rather than taking the nearest parking spot. It might be as simple as, just taking a walk after dinner, or, after breakfast, or during your break time at work, or just some sort of walking. Like, it doesn't have to be necessarily going to the gym or running or jogging. Simple, figuring it out into the day, finding a way where you can just incorporate it into the day. Doing 20 minutes every day of some sort of physical activity is key. And then when it comes to diet, we now, Niger people, we love our, starch and meats and all that. And that's fine to eat that. But I never say, when it comes to diet, I never say, oh, don't eat this or don't eat that. But it's all about balance, figuring out, okay, how can I get more fruits and vegetables in my diet, rather than focusing more on the meat and the starch. So really, the meat and the starch should not be more than a quarter each of your diet, but the fruits and vegetables should really be half of your diet if possible. You might feel like, oh, it's not enough, or I don't feel full with it, but it's really important to get those fruits and vegetables in your diet. And if you focus on doing that, the fruits and vegetables and the exercise, that goes a long way to affect everything from your cholesterol to your weight to the risk of developing diabetes. Next slide, please. And now I want to talk a little bit about smoking. Now, I don't know, how many of us smoke, but I know that it's something that, with young people, we kind of, grow up. There's a lot of influence of it in pop culture, in the environment, around us, and then we suddenly just go on and become smokers. It's part of like being cool and all that. But this is one of the worst things you can do to your body, because cigarette smoke does a lot of things. First of all, one of the things it does is it causes hardening and narrowing of your blood vessels. Now, when we talk about heart attack or heart disease, basically we're talking about the arteries that surround the heart getting really hardened and not supplying enough blood to the heart muscle. And one of the fastest way to get this to happen is through smoking. Cigarette smoke and the tobacco really accelerates the formation of this cholesterol plaque within your blood vessels. And once cholesterol plaque is increased within the blood vessels, then there can be obstruction of blood flow, not only to the heart. That's how we get strokes, because there could be obstruction of blood vessels to the brain. That's how we got what we call peripheral artery disease, which is a different kind of disease that can cause blockages in the legs and ulcers that don't heal. That can cause a lot of problems to the kidneys. So smoking really accelerates formation of plaque, and through that, it can cause all of these problems I've been talking about. In fact, smoking is one of the things that's as strong as diabetes when it comes to risk factors for heart disease and for strokes in general. So if there's one thing that you do right now that you can change today, smoking will be that thing. Next slide, please. So now let's just talk a little bit about cholesterol. I've talked a lot about hardening of plaque and cholesterol. Now, first of all, the question I always get asked is, why do you care about your cholesterol numbers? Now, the number or the amount of cholesterol in your blood test itself doesn't really matter just based on that number. But what really matters is that the higher our bodies don't have a good way of getting rid of excess cholesterol. So when you have excess cholesterol in your body, first of all, your body needs cholesterol. You need cholesterol for your nerves, for your skin, for your hair, for normal bodily functions. So your body produces cholesterol, but we also eat cholesterol in our diet. So when you join the two, so both the cholesterol that your body produces and the cholesterol that you eat, in general, oftentimes there's some sort of excess cholesterol in our body, and the body doesn't have a good way. Now, some of it goes out in the poop, in the feces when you go to the toilet, but a lot of it kind of hangs around in the body and has to go somewhere. Unfortunately, cholesterol then ends up in the eyes, on the skin, in the liver, and unfortunately also in the arteries. So if you look at the drawing, these are kind of like arteries that are cut open. So the upper artery is like wide open, it's like nice and smooth, and the lower artery has those lower yellow deposits that are kind of stuck to the wall. And if those deposits of cholesterol stay long enough in there, they can develop blockages, and then the artery is open because it has to go, the blood is trying to get somewhere, either to your brain or to your heart or to your body tissues. But when it's plugged up with the cholesterol plaque, then the blood flow that is supposed to go to that place then doesn't go there. And of course, when the blood flow doesn't go there, if it's the heart, then you have a heart attack. If it's the brain, then you can have a stroke. So cholesterol really contributes a lot to this plaque formation. And the cholesterol is accelerated based on genetics, based on your diet, based on having diabetes or smoking, causes a lot of deposition of this cholesterol within your arteries whenever the cholesterol is high. And one more thing I want to mention about cholesterol: we have good cholesterol and bad cholesterol. So HDL, or the high density lipoprotein, is considered good cholesterol. So for some, when you go in to get your cholesterol checked with your doctor, if your HDL, which is the high density lipoprotein, is high, that's good, because that high density lipoprotein is generally protective to the bodies, protective to the vessels and things like that. So the higher the high density lipoprotein you have, the better. Now, low density lipoprotein is the bad cholesterol. I call it the lousy cholesterol. The higher that is, the worse things are. So if your low density lipoprotein is too high, then that can cause a problem, and that can cause more deposition of this cholesterol plaque within the artery. So we want the higher density lipoprotein to be higher and the lower density lipoprotein to be lower, and that gives us a good balance of cholesterol. Next slide, please. So this chart I added on here because I know that these this PDF and these slides are going to go to people, later on when the talk is done. And I kind of want to show like how much smoking really contributes to worsening the risk. Now we have this what we call a risk score, which incorporates a lot of factors. So the risk score incorporates the age, the diabetes, the cholesterol, and all of that. And then we put it all into a score, and then we determine, okay, who is low risk, who's middle risk, and who's high risk. So for example, low risk, if you have a score, when we put it all together, if you have a score of less than 5% based on the algorithm, and then your intermediate risk if you're greater than 7.5%, and then your high risk when you're greater than 20%. And you can see in the chart there, both in men and women, if you do smoke, then it is more likely that you're high risk, even before anything else is calculated. Smoking really, really weighs in to increase the risk, even if you have like perfect cholesterol, you don't have diabetes, but just by smoking alone, that can on its own really do raise your risk, because it can increase the formation of this cholesterol plaque within the heart arteries. Next slide, please. So the question again is, when should I be screened? So we talked again at the beginning. The first question was, how do I know? Like, how is my, how do I know if I have heart disease? How do I know what risk factors I have? And I said the answer is you got to get screened. And the next question is, when should I be screened? Well, simple. I kind of just laid it out simply on this slide that for blood pressure, really, once you're 18 years old, you should get the first blood pressure measurement. Now, obviously, if you've ever been to the doctor, they check blood pressures even in kids. But in general, that's when you start focusing a lot on what the blood pressure is. So, of course, for all of us who are here, older than 18, you have to get your blood pressure checked. And not just a one-time check, you have to check it routinely whenever you go to the doctor. And if it's borderline, for sure, have a machine at home where you kind of keep an eye on it and see where it is. And then for diabetes, when should I be screened? And then it's really age 35. So if you've never had a hemoglobin A1C test done, at age 35, you should get one done. And then if it's normal, we can then say, okay, a couple years or 3 years, you can check it again. But if it's abnormal, then you start all those aggressive lifestyle changes or medicine, depending on what it is. And then when we talk about diet and physical activity, from when you're 18 years old, you should start working on that. In other words, today and right now. Smoking, you need to quit right now. Cholesterol, initially, kids are supposed to be screened, but if that screening is missed, then for sure, as soon as possible, we should start the screening. So right now, if you've never had a cholesterol tested, you should have your cholesterol done and tested, especially if you have a family history of heart disease. Next slide, please. And then the next question is then, how often should I get screened? So for blood pressure, every 3 to 5 years, 18 to 39 years old should be screened for hypertension. So in other words, when I say screen, I mean what happens when you actually go to the doctor. If it's normal, then it's fine. You should kind of check it again, especially if you don't have risk factors. But if you do have risk factors, if you have any family member with high blood pressure, whether it's an uncle or an aunt or a parent or a sibling, then you need to do it more frequently every year. And then for everyone who is 40 and above, every single year, especially even if you're completely normal, every single year you should have at least one blood pressure check. Personally, I check mine at least every month, because I have a home blood pressure machine. I kind of keep an eye on it, see where it is. If I get a high number, then I check it again the next day and I kind of keep an eye on it. But if it's normal, then, at least once a month. For diabetes, that first hemoglobin A1C that initially occurs that I talked about, that you do, the hemoglobin A1C that you do at 35, if it's normal, then you check it every 3 years. If it's abnormal, then you need to initiate lifestyle changes and check it again in 6 to 12 months to see if it's improved. If it's improved, then you continue with the lifestyle changes. If it's still abnormal after a year, then you really need to get on medicines, because that's what can get it under control. Next slide, please. And same thing with cholesterol. After the initial check, you check it again at age 20. And you check your cholesterol every 5 years until you get to age 45. And at age 45, it needs to be checked every year. And once it's abnormal, then you intensify whatever you're doing. If you're doing diet and exercise, you pay more attention to it. And then if it continues to be abnormal, by the next check, then you need to really consider medicines. Because again, cholesterol goes, and especially if you have other risk factors. For example, if you have diabetes with this or high blood pressure with this, then you really need to get more aggressive with the cholesterol check. Next slide, please. And then a few other points about high blood pressure. I talk a little bit on this slide about doing it at home. So yes, you go to the doctor and you do the screening every few years and all that, but it's always beneficial to kind of have it, whether it's at home, whether you go to a store where they have a free blood pressure test or something like that. Just whenever you have the opportunity, you don't have to check it every single day or every single week, but at least once a month. Just have, especially if you have it at home. Now, if you don't have a blood pressure machine at home, that's fine. Whenever you go to the doctor, which really should be every year at our age, you should have your annual checkup. You should always check the blood pressure, especially if it's ever been high. But if it's normal, that's fine. You can just kind of, keep it going. Next slide, please. And I talked about the EKG or the electrocardiogram earlier on in this slide. So basically, this is just a picture of what the electrocardiogram looks like. These are some other tests that, we can do that are not like the routine blood pressure check or diabetes test or a cholesterol test or quitting smoking. These are like electrodes that are kind of placed in certain spots in the heart. And then it does like the tracing of the heart. And then a medical professional has to read it to see if there's any evidence of heart abnormality. So an EKG is kind of a simple test that's really readily available, or should be readily available, at every most hospitals or clinics wherever in the world you are, that we should absolutely do to make sure that we keep an eye on our heart. And usually, once you do it one time, you really don't have to repeat it again. Unless if there's a problem, if you're having like any chest pain or shortness of breath or any other symptoms, or you have other risk factors with this. But at least you should get at least one EKG as a baseline, once you become an adult. Next slide, please. And just a word about aspirin use. So there's been a lot of talk, about aspirin use and how it's just like a simple medicine that can prevent heart disease and stroke. In general, not everyone needs to be on aspirin, but anyone who's between age 40 and 59 years old, who has a greater than 10% risk based on that chart in a few slides back that I showed you. The risk is calculated there, and you can easily calculate your own risk once once you have your blood test or you have your blood pressure and all that. You can just put it in that chart and see exactly what percentage your risk is. But if you're between the age of 40 and 59 and you have a greater than 10% risk, then it's reasonable to consider a baby aspirin, a daily baby aspirin, to prevent heart disease and stroke. Now, if you're between 40 and 59 and your risk is less than 10%, then you don't really need aspirin as a primary prevention. When I say primary prevention, it means you've never had a heart attack, you've never had any heart problems, but you do have risk factors and you feel like you're at risk for heart disease. Aspirin is so simple, available. It could be 81 milligrams or 75 milligrams, depending on what part of the world you are. It doesn't matter, but low dose aspirin is really key and helpful to prevent heart disease. Now, once anyone hits 60, once you're above 60, if you have, risk factors, then for sure you can use aspirin. But if you don't have risk factors and it's just age greater than 60, then there's a risk of bleeding. So we always try to balance the benefit of aspirin with the risk of bleeding in the stomach, for the aspirin. So if you're over the age of 60, and then you tend to have a higher risk of bleeding, and aspirin might not really be for you if you've never had a heart attack. Now, if you've had heart problems or had a stroke or anything like that, then you have to be on aspirin forever. However, if you've never had those things and you're above 60, then there's a risk of bleeding that we have to kind of measure. Okay, is the risk of trying to prevent a heart attack bigger than the risk of bleeding? And that's an answer that you can answer. That's a question you can answer with your doctors, when the time comes. But overall, for young people like us, the key thing is calculate your risk. If your risk is greater than 10%, for sure, you need to be on aspirin because it can prevent a heart attack or a stroke. Next slide, please. And, what other things, can we do to prevent heart disease? Now, one of the things that I do a lot, here in the US for my patients is a coronary calcium score. Now, remember when I talked to you about cholesterol plaque and how it can coat the arteries and kind of harden the arteries, one of the easiest ways to find out if you have already plaque within the heart arteries, because sometimes, let's say some people say, oh, what if I check this late? What if, by the time I'm checking it, it's too late? And, how do I know if, I already have plaque or cholesterol plaque deposits in my heart or in my neck arteries? One easy way, depending on what part of the world you are and whether or not it's available, is something called a coronary calcium score. A coronary calcium score is just like a quick scan. It's like a CAT scan that's done of the heart. And it looks for evidence of this, what we call plaque, which is like hardening of the arteries. And if you do find hardening of now normally for anyone who is, less than the age of 60, there should not be any hardening of the arteries. The coronary calcium score should be 0. However, If you do have hardening of the arteries and you're in your 30s or 40s, that's a big deal. That means you're at a big risk of a heart attack, 5 to 10 years down the line. So then that's when we get more aggressive. That's when, yes, you do the lifestyle changes, you do the diet and exercise, but you got to get on aspirin. You got to get on a cholesterol medicine called a statin, because that's how you can prevent further deposition of plaque. Because once plaque has formed, you can't really get rid of the plaque, but you can prevent it from getting worse and thereby prevent a heart attack or stroke down the line. So if you're in a part of the world where a coronary calcium score can be done, that's something that, I recommend you do, because it can answer a lot of questions, especially deciding whether to go on medicine or not, or just to focus on lifestyle changes. But if you're in a place where it can't be done, no need to lose heart, just focus more on what we call the traditional risk factors of testing your cholesterol, testing for diabetes, checking your blood pressures, quitting smoking, and working on lifestyle changes. Next slide, please. So finally, the key things to remember. Early screening is important. If there's anything you remember today, is the screening, because like I said, a lot of these things are silent and there are no risk factors associated, there are no signs that you can notice that you have them. So unless you test for them, you would never know. So early screening is one of the most important things you can ever do to detect this, because like I said, a lot of the things that cause, death from sudden cardiac death and other things, happen slowly over time. They happen after you've had this for like 2, 3, 4, 5, 6 years. So, but if you catch it early, then you can get it under control, and you don't have to worry that, oh, am I going to have a stroke, or am I going to have a heart attack, because you've caught it early. And at our age, there are people that have already had it in their 20s, in their 30s. So we need to kind of really focus on detecting it early, because then that's when you can prevent it and get it under control. And then in general, lifestyle changes, including diet and exercise, like I said, are key. 20 minutes of some sort of light or moderate physical exercise every day. You don't have to look for a special time where you have to go on a jog. Obviously, if you can, yes, do it, but incorporate it into your day. I found out that even for me personally, is a lot easier. If your tests are normal, what do you do? Well, you just recheck as recommended. If the tests are abnormal, for sure, you need to start treatment. And treatment might be simple as like lifestyle changes, but it could also be starting medicines, depending on what your doctor says. And if you have any questions about this, you can certainly reach out to me or any of the hosts, and they can connect you, and we can answer that. And then long-term monitoring and treatment is important. You need to really just monitor it and keep an eye on it. The fact that it was normal 3 years ago does not mean anything for today, because things have changed. You're 3 years older and things can change. And then obviously reach out and ask questions anytime. Thank you for listening. I'll just pause, and we can start off with the questions.
Thank you, Wobo, for that lovely presentation. So before I pass the mic to Ebinimi, she's going to handle the Q&A. I want to take the privilege of being your host today to kickstart the Q&A with my own. So Dr. Wobo, you emphasized the importance of exercising. Anecdotally, people who smoke or do not have a healthy diet but exercise are more likely to have a healthy heart than people who do not smoke, eat healthy, but do not exercise. What are your thoughts on that? My second question, as a follow-up, is what level of intensity of exercise do you recommend? For myself, I exercise quite a bit, but of course, because we're aging, more especially when you are doing like aerobic exercises, you start gasping for breath, right? Now, is it advisable to continue in that intensity, or do you regulate it at that point? What are your thoughts around managing the level of exercise intensity that we can do at our current age limit?
Okay, so I'm going to start with the first question, and that's about the smoking. So first of all, smoking. So if I have to choose between, do I smoke or am I fat, I'm going to choose that I'm fat any day. Obviously, it's not, advisable, but if I had to choose, I'll choose that. The reason is smoking really accelerates things a lot. Like with the plaque, what smoking does is primarily it goes directly for the plaque in the arteries. So I've never seen a person who smokes and does not have some sort of hardened plaque at then in their arteries somewhere. They would always have it. Now the question is, are they going to have a heart attack or are they going to have a stroke? And that's partly luck of the draw. But there's no doubt that if you do smoke, you will have the plaque in your arteries. And like I said, you cannot really have a heart attack unless you have plaque. And you can't have a stroke unless you have plaque. Now, you can have a stroke from blood clots, but that's less likely than having a stroke from having plaque. So the smoking really is like the final thing that just channels everything. So to me, I would say, like, if I had to choose one thing, smoking is the one thing that I would say, hey, that has to go. Now, when it comes to exercising, in general, like I said, I just focus on a little bit of just the timing of the exercise. So, for example, if I say over a 24-hour period on average, obviously that might not be possible every day, but on average, I have my my smartwatch on, and I need to go at least 20 minutes. I set it where I calculate my steps based on the time, and I say, okay, 20 minutes a day I'm doing some sort of exercise. I'm walking from the hospital to the car, or from the ward to the clinic, or something like that. I'm doing some sort of walking, or I just go around and do a little lap around if I have a little break at lunchtime. So that is more realistic to me. But if you're going to do exercise, then I would say if you're going to like hop on a treadmill, then it doesn't. I would say being out of breath, pushing yourself till you're out of breath is good, as far as you don't have heart disease. Now, how do you know you don't have heart disease? Simple. It still goes back to the screening. If you screen, you don't have severe diabetes, your blood pressure is fine, you're not having like chest discomfort, you're just out of breath from exercising, then that's fine. If you feel like you're really getting way out of breath, you can stop and rest and go again. But there's really no limitation at our age of what you can do. Obviously, some of us run marathons and things like that. I don't personally, but there are certain things that that, okay, I'm really getting to the limit. And everyone's limit is individual. For example, like you, opened that if you work out a lot, then your limit will be different from someone who decides after this talk, hey, I'm going to start exercising. So if you're starting after this talk to start exercising, well, don't kill yourself the first time. Obviously, when you get out of breath, but there's no limit that I can say, oh, only do it for 5 minutes, only do it for 2 minutes, because as far as you can still go, you can still go. And then when you're out of breath, you rest and you go again, because you're still having that time of that 20 minutes incorporated into it.
All right, thank you for that answer, Wobo. So clearly, it's okay to stretch the heart. I've heard some people say, yeah, we hear all these stories from doctors that we should exercise, but I mean, sometimes we find people, fall and have a heart attack while they're exercising, and then they try to dissuade people from exercising. So with that, I would pass the mic to Ebinimi to take over the Q&A session. Let's see how many questions we have gotten from the chat. And please, everyone, feel free to continue to send in your questions. And with that, Ebinimi, over to you.
All right. Thank you so much, Doc. This was quite enlightening. So afterwards, I'm going to have my BP checked and all of that. So the first question is there a relationship between stress management and heart disease? If there is, how do you have any tips for managing stress daily?
Yes, there's a direct link of stress management or stress and heart disease. A lot of times, we're under a lot of stress. At this age, some of us have young kids. There's just life, there's financial, there's just so much going on at this age that we certainly have stress. I myself definitely have a lot of stress. And one thing I do is I try to take, 2 to 5 minutes every day, whether it's early in the morning or at night before I go to bed, and just kind of have some quiet time for myself. I kind of do some deep breathing. My wife does a lot of meditation, and I'm kind of learning to do that. I recently started doing some yoga and stretching. Those things really help with stress management. Obviously, you can't take away all of stress, and everyone has different things that they do. But for me personally, it's like deep breathing, just some meditation and yoga and stretching, just kind of some quiet time where you just forget about everything. And it doesn't have to be like 30 minutes. I only have like 5 of those minutes every day, whether first thing in the morning or last thing at night or sometime in the middle of the day. But I try to do that. And it's very important to incorporate that, into your life. And everyone is different what they do. But this is what I do personally.
Okay, thank you. The second question is, are there any symptoms, any signs we could look out for that those of us 30 years and above could look out for to guard against heart failure?
Yes. One of the biggest signs is that you have significant chest pain or short or pressure or shortness of breath or sweat or something. It doesn't matter what the symptom is, but what matters is that it happens when you exert yourself. So, for example, back to, again, related to Open That's question, it's like, so if you tell me, hey, doc, whenever I walk across the hall or whenever I, walk for my car to the thing or I do something very that it's not like stressful, I get so out of breath or I get like I get some chest pressure, I get a headache or arm pain, but it seems to consistently happen each time you do like really little exercise that's not much and then tends to go away when you rest. That's a really big red flag. Because even if you're out of shape, sometimes people say, oh, I'm out of shape, I'm getting older. Even if you're out of shape, you shouldn't really be breathing so hard or so out of breath just by doing something little, but like, walking. And something little is different for everyone, but, just something that you feel like, oh, I see people my age are able to walk across the hall or do this or do that, the same thing, and they don't have those symptoms. But when I do it, I have it. That is a big red flag that you need to start getting checked out. So to me, that's the number one thing. Then other things are like, if your legs swell up easily, let's say at the end of the day, your legs are all swollen and puffy, or, you get out of breath when you lay down and you can't lay down, almost like you're pregnant, you can't lay on your back. You have to like sit up or prop yourself up with a pillow because you get so out of breath. Those are other things that you can look at. But the number one thing is any symptom, whether it's headaches or chest pain or shortness of breath or anything that happens when you do some kind of minimal physical activity that you wouldn't really expect that would happen and then tends to go away with rest, that's a sign that there might be something going on with your heart and, can be checked earlier.
Okay, the third question before I go into the chat room, is there a correlationship between the quality of sleep we have and heart disease and heart failure?
Yes. In general, so there's something called sleep apnea, where again related to obesity, where people get people lay down and they have trouble sleeping. You can kind of look it up, but basically there's sleep disruption that can affect the heart directly. And in general, the quality of sleep to me is directly related to stress. So if you don't have good quality sleep, different people say, 6 to 8 hours of sleep. I'm going to be the first person to tell you that I don't get that much sleep in a day. But generally, there's certainly quality of sleep that can cause stress. But it's not the only way that the quality of sleep can directly affect the heart is if a person has sleep apnea, where there's like some disruption of the airflow during breathing and sleeping. But the other way it can affect heart disease is through stress, through causing stress.
Okay, so I'll take one question from the live chat before going back to the questions I have here. This question is from Bella. Is screening included in your annual physical?
It should be. It should be, but then sometimes the doctors that you're seeing don't really know like the exact guidelines for you, or they feel like, oh, maybe they just check your blood pressure and that's it. But, more and more we're realizing that you have to get the blood test. Like it should be included, but depending on where you live and the kind of how thorough the doctor is, they may not do it because they may feel like, oh, you don't have any risk factors. But without knowing that, well, you might have some risk factors that we don't already know, and you have to have had the cholesterol checked. They kind of assume that maybe you've already done that, at some point.
Okay, are there some lesser known factors that can impact heart health? And if there are, how can we mitigate those?
Yeah, one of the major factors is inflammation. So things like, some people have like rheumatoid arthritis or there are other like inflammatory diseases, like kind of rheumatological diseases where there's like inflammation of the joints or the skin or Raynaud's. There's a long list of any kind of inflammatory condition. Anything that raises inflammation in your body, or I talked a little bit on infection. I didn't really dive into it. Like, viral infections, if you get like colds, regularly, viruses, things like that can raise the inflammatory level in your body. and generally can lead to that. So if you do have those in any condition that causes a lot of inflammation in your body, and one thing you can do is, kind of focus on getting those under control. And then if you feel like you have that, then maybe you're one of those that needs to be screened more regularly. So let's say if you're someone who has, Raynaud's or rheumatoid arthritis or something like that, then you might be someone who needs to check their cholesterol more frequently, or diabetes, or test the blood pressure, because all of those things can raise, the kind of the stress in your body, the internal stress, and they can eventually lead to heart disease.
Okay, so I would ask him one more question before I go back to WhatsApp. Could you elaborate on on typical changes that occur in our cardiovascular system as we approach the age of 30 and beyond?
So generally what happens is your heart, so over time, by the time you're an adult, your heart has reached the full size. It should be like a normal size heart when you're 16 or 18, and shouldn't really change much in size as you get older. However, as you get older, few things can happen. Your heart can get stiffer because, again, it's just beating regularly throughout your life. The valves can begin to leak or also get stiffer. Your arteries can get thicker, and just can influence the amount of blood flow to the heart muscle. It's harder to build muscle and to build strength as you get older, so your body is kind of more susceptible to like kind of the stressors that otherwise when you were 20 years old you'd be able to handle. And then generally our blood pressure tends to get higher as we get older, and as your blood pressure goes up, that can also affect blood flow to your brain, to your heart, and all that stuff. So those are kind of changes that happen as we get older, that are kind of natural changes, and that's why the risk overall of heart disease, just by virtue of getting older, goes up.
Okay, thank you very much. I can't find any questions on the WhatsApp platform, so I would like to okay, who's this? Okay, obesity, Kingsley. I would like to encourage the viewers to please drop their questions. One final question before I hand over to Obunda. Are there any specific dietary recommendations you could give to folks over 30 years?
Yeah, so basically with diet, I try to keep it really simple. I try to say, okay, make sure that half, or at least a quarter of your diet, of your meal, is like fruits and vegetables. And then obviously, we're so much into where we eat a lot of starch and all that, but fruits and vegetables, and then meat, fish, whatever, that's fine, but focus more on like the white meats versus the red meat. So if I'd rather go with chicken versus beef, or fish versus beef. Doesn't mean that you should never eat beef, or you should never eat goat meat or anything like that. Absolutely eat those, but just make sure that your diet has some sort of like vegetables and fruits in it. And rather than being mostly, for us in Nigeria, the main thing is the starch, the rice and the eba and the fufu. That's the main thing. And that's fine. But just kind of maybe rather than taking the whole thing that you normally do, take like half of it and then replace the other half with like fruits and vegetables, because then that kind of helps balance things.
All right, thank you so much.
Sorry, there's a question on the screen.
No, go ahead.
Yeah, if you're already on beta blockers and blood pressure medication, should you still exercise until you're out of breath? And if yes, aside from walking, what else should you recommend? So I would say yes, you should still exercise, because the blood pressure medicines, yes, help with the blood pressure, but the goal of the blood pressure medicines are so normally when you exercise, your blood pressure goes up in a healthy way, and then it eventually comes down. But then when you have high blood pressure, in general, your blood pressure goes up way higher than it should when you exercise. But that's why you should be on blood pressure. So if you're already on blood pressure medicine for high blood pressure, then the recommendation for exercise is still the same. Still exercise until you're out of breath, then you rest, then you can go again to complete that 20 minutes a day of exercise, because exercise can't really be replaced by anything. You kind of, no matter how healthy you are, you really need to, because what happens is when you exercise, the heart gets pumping. It kind of pumps up, it gets the strength, it rests, it's so used to that, and then it goes over and over and over again, and then it gets stronger over time. So whatever your risk factors are, exercise is still important. Obviously, if you have heart disease or you have heart failure or you have blockages in your arteries, the amount of exercise you can tolerate will be lower, but you still need to exercise. In fact, when people have heart attacks and I put stents in their heart or I treat them for heart failure, one of the things I do after I do that is do what we call cardiac rehab, which is an exercise program that they have to do for 3 months. Because I always do that, because that's one way to really get the heart stronger. So the fact that you have risk factors is definitely a reason to exercise more. And then there's a question here saying, what's the best time to exercise? Before, after meals, morning, afternoon, or evening? So I would say after meals. So typically what I do is after dinner, I just go on a short walk, just to kind of walk, because what happens is when you exercise after a meal, obviously after a meal, you can't really go run a marathon. I mean, you can, but, it might upset your stomach and things. But, I just do a simple walk after dinner as much as I can. I don't do it every day, but as much as I can, because then you kind of get things moving. You get your GI system moving. You get your, your blood flowing and things like that. Sorry, guys, let me just take this quick call. I'll just mute it's like call from the husband.
All right. So while we're waiting for Wobo, I don't know. I'm not a doctor, so I can't answer these questions. But maybe we can first of all maybe start looking ahead on what this roll call thing will be about going forward. I think so far this has been an incredible, insightful, and informative session.
Sorry, guys, I'll answer this question about alcohol in a second. Just 1 second.
Okay. So guys, imagine what our next episode will look like with Lady Nali. He will be presenting on financial education, connecting the dots for economic decision making. You all will agree with me that in this current inflationary period, wherever you are in the world, inflation seems to be eating away our slim resources. So if you want to empower yourself to make effective financial or economic decisions that can change your life, join us again July 6th for Lady's presentation. I am hopeful that it will be as insightful as Dr. Wobo's presentation.
Okay, sorry, guys.
All right.
Sorry, I'm actually at work, so they were calling me for something, but that's fine. I can talk for a little bit more. So about alcohol. So I drink. Let me just start by saying that. Not as much now as I used to, but I have like maybe a glass of wine every week, a couple weeks or something with my wife. But so I would not say that don't drink alcohol at all. But generally speaking, they define that, like the USPTF, they define like moderate alcohol consumption. Now their definition of moderate alcohol consumption is like, say, 2 glasses of red wine, or like 2 drinks a week kind of thing. Now, so if you tell me that, okay, I'm having 2 drinks a week, absolutely fine. There's no problem with that at all. In fact, so some people say, oh, if you're someone who drinks red wine, 2 glasses a week, then that's fine, because that really helps the heart a lot. I don't know about that, but because there's conflicting information about that. But if you tell me you drink 2 drinks a week, that's fine. But then it's hard for me to really know, and the data is not really clear where you draw the line of like, okay, if I have a glass of wine every night, that's fine. But then what happens if I have 3 glasses of wine every night? Where does it, because it's not just about the heart. It's also, when it comes to excess alcohol intake, it's about the liver. It's about, the vitamin absorption in the body. It's about so many other things that alcohol does. And it's really hard to know where to draw the line. So usually what I say is, maybe make it like a weekend thing rather than an everyday thing. Make it like, okay, on the weekend, I have like, 2 or 3 glasses or 2 or 3 drinks. And I think that's fine, because that's something that would not increase the risk, not just of the heart, but I'm thinking of other things as well, the liver and other things.
Okay, so if we don't have any more questions, Ibinime, do we have any more on your side?
None.
Okay, so we are coming right on the hour here. But before we wrap up, let's take a moment to recap some of the key takeaways from Dr. Wobo's presentation. Dr. Wobo began by emphasizing the importance of prioritizing heart health as we journey through our 30s and beyond. He highlighted the changes that occur in our cardiovascular system during this stage of our lives and the significance of understanding common risk factors for heart disease. Early monitoring and early screening are essential. When it comes to dieting, we learned about the importance of adopting a healthy eating plan. A meal, that it's rich in fruits and vegetables. We can still eat our goat meat and cow meat, but all in moderation, because some of us can't do without our pepper soup. Um, Exercise emerged as another crucial component of maintaining a healthy heart. He also recommended incorporating regular physical activity into our routines, including exercises like walking, jogging, going to the gym, get on the treadmill, and these activities help to promote cardiovascular fitness. Furthermore, Dr. Wobush emphasized on different stress management techniques. A few minutes of meditation, or stretching, or yoga, or deep breathing can be helpful for reducing stress levels. He also delved into the importance of being vigilant for warning signs and symptoms of heart problems, such as chest pain, shortness of breath, and palpitations. And understanding these signs and seeking prompt medical attention can be life saving. So, as we conclude today's session, on behalf of Federal Government College Port Harcourt 98 set, I want to first and foremost express my sincere gratitude to the brains behind conceptualizing and coordinating an event like this. I personally didn't hesitate to participate because I knew that these conversations may either save a life or will empower us to educate members of our families. And then, of course, this is a part of our social contract to humanity. So, to the leadership and to the coordinators, our IT team, Ibomi, Chineye, Oge, Tonye, I say thank you to you all. And to our guest today, our own Dr. Wobo, words are not enough to express our appreciation and our gratitude for sharing your expertise and invaluable tips with us. We know that if not for your passion for humanity and your commitment to social change and improving health outcomes, we would not be able to afford an hour of your time, even if we attempt to empty our welfare account at this current exchange rate. My brother, we cannot afford to pay you for your time. Therefore, we say thank you, our dear friend and brother. We wish you God's blessings and pray that you will continue to soar higher and continue to make us proud. And to our patient and faithful audience, I'm not sure how many people we got here live. I want to thank you all for listening and thank you for your great questions. I personally found the Mobile Theophilus' question very interesting. I wouldn't have expected any other question from him about alcohol consumption, but that was a very good one. So thank you all. You all made this virtual show worthwhile. But remember, the journey to great heart health doesn't end here. It's about making informed choices every day and prioritizing our well-being. Everything, including our health, is a series of choices. So choose right. And with that, on behalf of myself and my co-host, Ebinimi, until next time, stay well, stay healthy, and take care of your hearts. Bye, folks.
Bye.
I get the band. run it, run it, run it, run it. Whoop, whoop. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run up, run it back. Run up, run up, run up, run up, run it back. I get it back and I run it up.